Hello everyone, I am Dr. Amit. Before we jump in, please make sure to subscribe to my YouTube channel so you don't miss any of our upcoming high-end medical lecture. So in our previous video, we have already built a solid foundation by discussing on the general classification of gram-positive bacteria and diving deep into this Staphylococcus family. So today we are shifting our focus on another powerhouse in clinical medicine, the Streptococcus family. So we are going to break this down by their hemolytic patterns and clinical significance. Specifically looking into at Streptococcus pneumoniae, the Viridans group, Streptococcus pyogenes, Streptococcus eclecticus, and Streptococcus galolyticus. So we have also previously we have discussed this chart that gram positive we do gram staining, purple or blue, and then it's classified into three groups: bacilli, cocci, and branching filament. Then we do catalase. Catalase positive or Staphylococcus, if negative then Streptococcus. So today we'll deal with this Streptococcus family. Okay, so let's start Streptococcus. So we'll start with Streptococcus pneumoniae. So let's first talk about its about its lab characteristics. Okay, so Streptococcus pneumoniae is gram positive, alpha hemolytic, and they are optocin sensitive. Okay, so when you talk about its morphology, so they are described as lancet shaped, okay, diplococci, and they are encapsulated, and they produces IgA protease, which helps them to colonize on mucosal surfaces. Okay, so now we'll talk about its clinical presentation. Okay, so while talking about the clinical presentations, we must remember that their most common infections are meningitis, otitis media, pneumonia, and sinusitis. Okay, so we can remember by a mnemonics called MOPS: meningitis, otitis media, pneumonia, and sinusitis. So from clinical point of view, okay, watch out for patient with any anatomic or functional hyposplenia, okay, like in sickle cell disease, because they are highly predisposed to severe infections from Streptococcus pneumoniae. Okay, so whenever you see any patient with anatomic or functional hyposplenia or asplenia, then always think about Streptococcus pneumoniae infection. Then a very classic clue, which is mainly asked in USMLE exam or any PG entrance exam, whenever you see a rusty sputum, always think about pneumococcal pneumonia. Okay, then always remember that without the capsule, okay, they are encapsulated, right? So no virulence without capsule. If the Streptococcus pneumoniae have no capsule, then they have no virulence factor. Okay, now we'll talk about the vaccination. Okay, pneumococcal vaccinations. So we have two types of vaccines. One is conjugate and one is polysaccharide. Okay, so while talking about the conjugate vaccine, we have PCV13, PCV15, and PCV20. Okay, and this conjugate means they produces antibody. Okay, and this polysaccharide vaccine is PPSB23. Okay, so which does not induce a strong antibody memory response. Okay, so basically they do not produce antibody. Okay, so this is all about Streptococcus pneumoniae. Okay, now we'll look in Viridans group of Streptococci. So while talking about its lab characteristics, they are also gram positive like Streptococcus pneumoniae. Okay, they are alpha hemolytic, and but they are optocin resistant. Okay, Streptococcus pneumoniae are optocin sensitive, but Viridans groups are optocin antibiotic resistant. Okay, after then we'll talk about that they are normal microbiota of nasopharynx. Okay, now the second thing is we must remember their key species. Okay, that is Streptococcus mutant and Streptococcus mitis. Okay, so this both species causes dental caries. Okay, so whenever you see dental caries in patient, okay, then always think of Viridans group of Streptococci. Okay, in MCQ also they try to give a clue by giving dental caries. Okay, now the third member of this group is Streptococcus sanguinis. Okay, So whenever you see the word sanguinis, always remember of blood. Okay, so Streptococcus sanguinis is particularly dangerous if it enters the blood. Okay, so if it enter on the damaged heart valves, then it causes problem, and sometimes it also causes subacute infective endocarditis. Okay, so this is all about Streptococcus pneumoniae and variance groups of Streptococci. So now we'll talk about the next member, that is Streptococcus pyogenes. Okay, and they are also called as group A Streptococci. Okay, so talking about their lab characteristics, they are also gram positive. Okay, they are beta hemolytic. Okay, so beta hemolytic means complete hemolysis. Okay, and this Streptococcus pyogenes or group A Streptococci are bacitracin sensitive, means they are sensitive to bacitracin antibiotic, and PYR positive. Okay, and talking about their virulence factor. Okay, their main virulence factor is hyaluronic acid and M protein. Okay, and this inhibits the phagocytosis. Okay, now while talking about the disease manifestations, okay, so it mainly causes pyogenic group, toxigenic group, and immunogenic group. Okay, so we'll talk one by one. Okay, so in pyogenic, it causes pharyngitis, cellulitis, impetigo. Okay, so whenever you see impetigo, always remember a classic term, honey crust. Okay, and then erysipelas. Okay, then in toxigenic, it causes scarlet fever, toxic shock like syndrome, and necrotizing fasciitis. And in immunogenic, it causes glomerulonephritis in kidney, then rheumatic fever. Okay, so we'll talk a little bit in detail about rheumatic fever here. Okay, so actually our body make antibody to this M protein. Okay, it's about antibody to this virulence factor. Okay, so this M protein is structurally similar to host protein called myosin in the heart. Okay, so when our body make antibody for M protein, it unfortunately cross react with myosin also. Okay, and due to molecular mimicry. Okay, and here causes autoimmunity, and finally it leads to carditis in acute rheumatic fever. Okay, so this is how it affect in rheumatic fever. Now we'll talk about second, scarlet fever. Okay, so we have in toxigenic, we have also read about scarlet fever. Okay, so let's talk about its characteristics, that it causes it look like blanching, sandpaper like body rash. Okay, strawberry tongue, and circumoral pallor. Now the next part, the important part, is how we'll diagnose these Streptococcus pyogenes group A Streptococci. So to diagnose it, okay, so we use throat swab. After then we can for antigen detections, and we'll culture on blood agar. Okay, and then we can do ASO titer and anti-DNase B antibodies. Okay, so this is all about Streptococcus pyogenes group A Streptococci. Now we'll talk about Streptococcus epilepticus, which is also called as group B Streptococci. Okay, so talking about its characteristics. Okay, so they are gram positive, beta hemolytic, but this group is bacitracin resistant and PYR negative. Okay, so in the previous Streptococcus pyogenes, we see that bacitracin sensitive and PYR positive, but there is a difference, that Streptococcus epilepticus are bacitracin resistant and PYR negative. Okay, so it normally colonizes in vagina. So while talking about its clinical significance, it causes always remember that they are mainly a pathogen for babies. Okay, so it causes pneumonia, meningitis, and sepsis in baby. Okay, now we'll talk about its virulence factor. So its main virulence factor is polysaccharide capsule. Okay, and it also produces CAM factor. Now the main clinical importance we'll talk in this disease is always screen. Okay, for patient at 35 to 37 weeks of gestation with rectal or vaginal swab. Okay, if the patient is positive, then we'll provide penicillin, okay, or ampicillin prophylaxis to prevent colonization in of the newborn. Okay, because it can cause permanent hearing loss in infants. So sometimes MCQ asks that in which week we usually screen the patient. So in 35 to 37 weeks, if positive, then we'll give penicillin or ampicillin coverage prophylaxis. Okay, now we'll talk about the last, that is Streptococcus galolyticus. Okay, so it's talking about its lab characteristics. They are also gram positive, gamma hemolytic, and they normally colonizes in gut. Okay, So the main thing is it causes bacteremia and infective endocarditis. Okay, so most importantly is there is a highly increased incidence of colon cancer associated with these infections. So if you see this in a patient blood culture, you must walk them off for a gastrointestinal malignancy. So this wrap up our deep dive into the Streptococcus family. I hope this help you clarify these important clinical distinctions. So please subscribe, like, and share this with your friends. Thank you.